When you think about the states that have been hit the hardest by the overdose crisis, Nebraska probably isn't the first place that comes to mind, right? I mean, the official numbers, they paint a picture of a state that's, well, relatively safe. But there's a different story unfolding, one that's a lot more dangerous, happening just beneath the surface. And what that story reveals, it could change how we see this crisis, not just in Nebraska, but pretty much everywhere.
So that brings us to the big question we're really digging into here. Is Nebraska somehow immune to this national crisis, or is there something that we're all missing? Well, the answer is way more complex, and honestly, it's a lot more alarming than you'd probably think. I mean, on paper, everything looks fine. For years, the data has consistently put Nebraska way down at the bottom of the list for overdose deaths. And that perception, that data, it shapes everything, including how federal resources get handed out. But what if that official story, the one the numbers are telling, is just plain wrong?
Okay, this is where it gets really interesting. This is what cracks that official narrative wide open. An investigation found that some rural counties claim to have had 0 drug-related deaths for 2 decades. I mean, come on. Experts are pretty sure this points to a massive undercounting problem, probably because of a lack of autopsies and screenings. So overdose deaths just get misclassified as something else. The crisis isn't missing, it's just been completely invisible. And being invisible is especially dangerous right now because the drugs themselves have changed so dramatically. We are in a totally new era, defined by synthetic drugs that are just deadlier and way more unpredictable than anything we've ever seen before. So, the main engine driving this new crisis is fentanyl. And this slide really puts its power into perspective. It's not just a little bit stronger than something like morphine. No, it is up to 100 times more potent. That's a mind-blowing leap in how lethal a drug can be. And if you want to know what that potency means in the real world, just look at this. 2 milligrams, that's an amount so small it can literally sit on the tip of a pencil. And that can be a fatal dose. Since it's often mixed into other drugs without people even knowing it, the risk of an accidental overdose is just astronomical. So the key takeaway here is the sheer speed and the scale of this whole shift. Just look at this number. A more than 1,000% increase in death rates in only 6 years. This isn't some slow-moving problem. It's an absolute explosion. And it's not even just about fentanyl by itself anymore. We're now dealing with what's called polysubstance use. Basically, it means people are often taking multiple drugs at once, and sometimes they don't even know it. Because fentanyl is used to lace everything from cocaine to fake pills, it turns every single dose into a total gamble. And this whole trend of mixing drugs has led to an even more terrifying threat, xylazine, also known on the street as tranq dope. And listen to this, this is not an opioid. It is a powerful animal tranquilizer. And when it's mixed with fentanyl, it creates this horrifying cocktail that's incredibly effective at shutting down the human body, and it causes these awful flesh-eating wounds. Now, here is why xylazine is such a total game changer for first responders. The life-saving drug naloxone, you know it as Narcan, it works by reversing the effects of opioids. It can get someone breathing again, but it does absolutely nothing for the tranquilizer effects of xylazine. So even after someone gets a dose of Narcan, they can stay unconscious, totally unresponsive, and in really, really grave danger. Okay, so faced with this hidden but very quickly escalating crisis, Nebraska is now getting ready for a massive, coordinated response. So let's take a look at the plan. The state is going to get over $150 million from those big national legal settlements with opioid manufacturers and distributors. That is a huge influx of cash, and it's all dedicated to one thing, turning the tide on this epidemic. And the strategy for how they're going to spend this money is really all about immediate impact. As you can see from this chart, the payments are heavily front-loaded. The biggest chunks of money are coming right now, in these first few years, to quickly build up the infrastructure they need to start saving lives. So what is all this money actually going to do? Well, the state's plan is built on a really comprehensive, evidence-based approach that's designed to tackle the problem from every single angle. Basically, the whole strategy rests on 3 big pillars. First up is prevention. Educating people, especially kids, about the dangers and making it easier to get rid of old pills safely. Second is treatment, expanding access to proven medications and creating new crisis centers. And third, and this is so important, is harm reduction, just getting that overdose reversal drug naloxone into as many hands as possible. Now, a really key part of that treatment pillar is the creation of these rapid access centers.
And this is all about changing the system. Instead of law enforcement taking someone who's in crisis to jail or to an already overwhelmed emergency room, they'll have a dedicated place to go where people can get immediate help from mental health professionals.
And if you want to see that harm reduction pillar in action, just look at this list. The plan isn't some far-off idea. It's literally happening right now. You can walk into any of these pharmacies all across the state, from Alliance to Omaha, and get naloxone for free. This is all about empowering regular people and communities to save lives. So, Nebraska has a plan. It's well-funded, it's multifaceted, and it's aimed at a crisis that's been simmering right under the surface for years. But this fight, it's really just getting started. The state is mobilizing like never before, that's for sure. But it's going up against an enemy that is always changing, from fentanyl to xylazine to who knows what comes next. So the crucial question we're left with is this: will this ambitious plan really be enough to rewrite Nebraska's story?